Thanks everyone for joining us for ALD's new series open to all of our members, ALD Career Conversations. So last year we switched ALD's tagline to taking you from first year to career. And this series looks to really do that and to explore the path where you are now as a student and how to get to a career that you want, say in public health. So we're grateful for our alumni like Natalie who have come to share their pathway. And we're also really thrilled to have so many students on the call today. So we'll get started with introductions. But I'm Trish. I'm the Director of Communications for National Alpha Lambda Delta. I work in the national office and I support our members and our chapters. And our guest speaker today is Natalie Southgate. So Natalie was inducted into ALD in 2014 at Converse College. She double majored in history and politics and double minored in biology and dance. She earned her master's in health policy and management from the Rollins School of Public Health at Emory University. She currently lives in Atlanta, where she's the public health analyst at the Center for Disease Control and Prevention in the Division of Global HIV and Tuberculosis Program Budget and Extramural Management Branch. Natalie, that is a mouthful.
Yes, we speak in acronyms at CDC. So in CDC lingo, I'm in DGHT and FABEAM, but you guys would have no idea what I was saying if I didn't do that.
Perfect. So I thought we'd get started, Natalie, with just a few kind of fun questions to break the ice. So if you could only eat one meal for the rest of your life, what would it be?
It would have to be Korean barbecue, all you can eat from D92 in Decatur, Georgia. If you're in the area, go there. It's totally worth it.
Good to know. So COVID magically disappears and you went an all expense paid week-long vacation. Where are you going?
Definitely to Scotland and Ireland. My family is Scottish on my mother's side, and Ireland has the Game of Thrones tour. So definitely would want to go see that because I'm a huge fan of the show.
So what did you want to be when you were younger?
So ironically, I wanted to be a fashion designer when I was a little girl. I watched a fashion show when I was probably like 8 or 9 years old, and I just started drawing dresses and dresses and dresses. And it wasn't until probably junior year of high school when they start asking you like really seriously what you want to do that I started maybe reevaluating that. But for the longest time, it was a fashion designer.
Nice. Very nice. So kind of to crack into some of the real questions. So I'm wondering what role ALD played in your undergraduate experience. So for some students, they just join and it's, the recognition of joining that kind of propels them forward. Some students, become involved in leadership and opportunities. So kind of what role did ALD play in your undergraduate experience?
Yeah, so for me, I joined for, the recognition. It sounded like a really amazing opportunity to open doors later on in life. And for me, what it really gave for me and what kept going through college was the motivation and the mentorship that I had. Our academic advisor was really, really supportive of all the Alpha Lambda Delta students, and that was a really big part for me.
Are you referring to Miss Dr. Steele?
I am Dr. Edna Steele. She is wonderful, wonderful. She still roots us on to this day. I've been out of college for 3 years now, and she still celebrates my accomplishments and each and every one of us that have graduated and moved on. And that's really, really special.
That's great. Yeah, she's wonderful. She served on our board of directors for a while. So when you look at your majors, so you majored your undergrad, you were what? Politics and history, and then you minored in biology and dance. So how did those experiences prepare you for your career?
Yeah, so Converse College is a liberal arts college, and I think that really, really helped me when it came to my graduate career at Rollins and then my career now, because having a liberal arts education and being someone from the history and politics field in public health, I kind of think outside the box a little bit more. I analyze things. I'm trying, like, you try to understand why things are done the way they're done, why things happen the way they happen. And I think having that background from Converse College's history and politics department really helped me see things differently than my classmates and my colleagues who have more medical backgrounds. And I did have a little bit of the medical background being a biology minor, so I could understand what they were saying. But then I had that other piece to come in as well.
It's really cool. And can you talk about maybe some of the internships or undergraduate research that you did that kind of helped you find a career in public health?
Yeah. So Converse, we in the history and politics department, we're required to do a senior thesis, and if you're a history and politics double major, your thesis has to cover both. And I remember sitting in on a class, it was Middle Eastern politics, and the professor brought up the Hajj, and he just kind of flippantly mentioned like diseases in the Hajj. And I thought, that's really cool. Like, I want to kind of dive into this further. And I talked with one of my advisors about what can I do with this? What can I research on this? And so I spent a lot of time my senior year researching epidemic spread from the Hajj, especially in the 20th and 21st century, looking more modern, how that looks now, how the Hajj looks now, the impact of globalization. So how it's easy for us to get on a plane and travel halfway around the world in a day. And that really helped prepare me for my career in public health, because going into my graduate degree program at Rollins, that senior thesis was really my only exposure to the world of public health. And so doing that senior thesis, doing that research by something that just sparked my interest in a class totally unrelated, I thought, this is just really cool. And I am interested in public health, so let's do it. I mean, that solidified for me, yes, this is what I want to do. I want to be in this. This is the field that's for me.
Cool. So did you go straight from your undergraduate experience into grad school? Did you take a gap year or two, or?
I went straight to graduate school. I knew that if I maybe took time off, I probably would lose my momentum just knowing who I am as a person.
Sure.
One of my best friends and classmates, she took some time, and that was the best thing for her, was to gain life experience. I think there's no magic one size fits all silver bullet when it comes to going to graduate school. I think you have to look at yourself and what works for you.
Yeah. And so can you talk a little bit about your experience getting your master's in public health? So, were there, internships that you had to do? What were your classes like? What were there certain areas you could focus in, or is it more of a broad thing? I guess tell us all about public health.
Yes. So my master's degree program, so I got my master's in public health at Emory University with a concentration, with my degree in health policy and management and a concentration in policy. So we had several departments that you could get your master's of public health in. We had health policy and management, which was mine, global health, environmental health, biostatistics, behavioral health and behavioral science and health education. I'm epidemiology, field epidemiology. There's so many more fields, but this is just what I can remember off the top of my head. So I studied health policy and management, and that was very economics heavy, very heavy in economics. And I was not anticipating that, but I'm glad that I did that field, because sometimes I kind of questioned, like, is this for me? But what it taught me, having the health economics, it taught me to look at things in a different light. And yeah, so really public health is so broad. I mean, health policy and management is just one pillar of it. And I just focused on health economics, mostly policy analysis. And, there's a niche for anyone in public health.
Yeah, and I think that's why it's such an appealing major to so many people, because there are a lot of options in there. So did you have a mentor? I know Dr. Steele from your undergrad, served as kind of a mentor, but did you have any mentors, either formal or informal, in the field If so, how'd you find them? If not, how would you advise students maybe to find one or to find someone to help them learn about public health?
Yeah, so one way to find mentors is through your professors. I mean, they're an amazing resource, and find mentorship and professors you connect with. So one of my professors that was actually my advisor for my senior thesis, even though he was a history professor, he actually does a lot of historic work with pandemics, epidemics, epidemiology, kind of medical history. And so he's the one that introduced me to public health. And he said, there are these former students that are doing this and they're doing this, and they're, going out in the fields during the Ebola outbreak, and they're working at the CDC on policy, and they're working at the Department of Defense on bio warfare. And that's what kind of introduced me to public health. And so I would say that's one way to find mentors is your professors. Another place you can find mentors, and one place where I found a mentor, is I went to a Visit Emory event, and I was sitting in on a panel discussion with people from the health policy and management field that had gone on and had amazing careers. And one woman in particular, she stood out to me. And I looked at my mom and I said, I want to be her when I grow up. Like that's what I want to do. She was saying everything that I had said was why I wanted to go into public health. So I plucked up some courage and went up to her afterwards and said, hi, my name is Natalie Southgate, and I really want to know how you got to where you are today, because that's where I want to be. And from there, we just developed a relationship. And you would be surprised. Like we kind of, as young individuals, young professionals, we're scared to talk to people. We're scared to put ourselves out there and say, hey, I want to be like you, don't be like mentor me, but just put yourself out there. Like, say, hi, I'm interested in what you're doing. Can we talk? Can we have coffee? Can we have a Zoom chat over virtual coffee? I mean, you'd be surprised. Most people are willing to help and share because they had a mentor that they reached out to one day.
Yeah. And I mean, I think you find that with any field, you're a little intimidated to ask, but the bottom line is, people, especially successful people, really like to talk about how they got to be successful, and they want to help other people get there. So you almost have to kind of, like you said, take that first step and kind of get over that I'm nervous, and you do connect with some great people. So like, are there any professional organizations that you would suggest students get involved in, or do they not really? I guess, do they exist for public health?
I know the Association of Schools for Public Health. That's who you have to apply through to Schools of Public Health. I think their acronym is ASPPH. That would be a great resource. I know ORISE has opportunities for undergraduates to do internships. If they're in a STEM field, if their degree is in a STEM field, ORISE is a good internship opportunity. That's what I can think of off the top of my head for undergrad students.
Great. So Natalie, talk to me a little bit about what a typical day at work looks for you. And I'm interested to know kind of what it looks like now and what it looked like before the pandemic hit. So if it changed at all.
Yeah, so my work and what I do in the Division of Global HIV and Tuberculosis, it didn't necessarily change with coronavirus, since we are a disease-specific division. But I don't really have a typical work day. I don't think anyone in CDC really does. Some days it's lots of emails, other days it's lots of calls and conversations with my team about how to change our processes, how to evaluate what we're doing. It really just depends. And I think that's the great thing about public health is you hear doctors and nurses say no day is the same, every day is different, you never know what's going to happen. I think public health is very much like that. You never know what's going to happen. You don't know what you're going to be doing the next day. You have an idea, but it's such a dynamic field. It's really awesome, and it's never boring.
That's always helpful. So what's your favorite thing about your career, if you had to pinpoint it?
I would say my favorite thing is when I step back and I see that the work I do helps to save lives and preserve the health and lives of others. I think that's such a rewarding part of my job because people don't realize how important public health is, and what we do. It's the I kind of call it the non-medical side of medicine. And so just the things that people do in public health, in the end, it's to the betterment of society and the betterment of the health of society. It's to preserve and prolong healthy lives.
If you, so looking back on your undergraduate experience, what's one thing, kind of knowing what you know now in the field, that you wish that you would have done as an undergrad to better prepare for a career in public health?
I definitely would have studied more statistics. I definitely would have learned Excel. So when I went to my graduate program, I apparently was the only one who had never seen Excel. Like, I kid you not, I did not know how to add in Excel. It was just not a skill we needed in the history and politics department, or I think even the biology department, that in the classes that I was in. I took classes, I took the initiative, I like went online, watched tutorials. I asked my friends who were well versed in Excel, like, hey, show me how to do these things. At my internship, so Emory has a internship experience called the Rollins Earn and Learn program, the REAL program. And basically what that is they help you, Emory helps you get your foot in the door with internships at places like CDC, the Children's Hospitals of Atlanta, CHOA, Emory University Hospital Systems, the Carter Center, other places in the Atlanta area, which is a huge hub for public health, like the capital of public health in the world, some people would argue. And I went to a statistician in my internship and I said, hi, I want to do this project, but I don't know anything really about doing statistics in Excel. Can you help me? Can you take 30 minutes a week to just show me and teach me some things? And I learned Excel really fast, but I think I definitely would have liked to have done more statistics and more Excel, knowing what I know now, and even getting into some like SAS and Stata and R, like all those statistical software programs too.
So what advice do you have for students going into the career of public health?
I would say don't feel like you have to check off a certain amount of check boxes. If you're still deciding your major, and I'm not here to say like a public health major is a bad thing. If you're majoring in public health, go for it. But don't feel like you have to take certain classes and check these certain check boxes off, because public health needs everyone. Public health needs statisticians to crunch the numbers. They need people to present the data. They need scientists to do research in the labs. They need communications specialists to put together communication materials that they'll post on social media and on websites and distribute to doctors' offices. They need graphic designers. So those flyers that you see at your doctor's office that say CDC in the corner, they needed a graphic designer to work with a communication specialist, to work with a scientist, to work with a biostatistician to put this together. And so I would say do follow what you're passionate about. If you're really passionate about graphic design, but you're like, oh, but I want to do public health, there you can do both. And I think that's one thing that's so great about the field is you don't have to check any sort of checkbox to be in the field of public health.
So Natalie, I want to give everybody a chance to ask any questions that they might have. So if you have questions, please turn on your microphones, or if you're happy, we'd love to see your face on camera, but totally get if you don't want to, or type it in the chat and I can kind of field them from there. But kind of what questions do you have for Natalie?
Hi, so Emory University is like actually my dream school for like a master's in public health. So I was wondering, like, what do you think made you a strong applicant to get into that school?
That's an interesting question because it's funny. A lot of us, when we got to Emory, we were so in awe of who we were around that all of us had the imposter syndrome of like, how did we get into this program where, James Curran, Jim Curran, the man who was on the HIV task force in the 80s, is our dean. I would say the senior thesis really helped. So taking my non-public health degree and doing my senior thesis in a public health topic, I think that helped. And I think, just taking an interest in public health, and I had internships at hospitals and did a lot of work where I tried to marry my interest in the medical field and the history and politics classes I was taking. I think that helped. But again, it's an interesting question. Sometimes I still don't know what I did.
I had a question on another panel that I thought was interesting. What has been your most rewarding experience in public health?
This is a hard one. I think for me, we were sitting in a division, all hands, the division of global health, HIV and TB. We were in this all hands, and another branch was presenting, and they were talking about the outcomes in the countries that they were working in and the reduction of the incidence of HIV, and how children were thriving and prevention of transmission of mother to child was down. And I just remember sitting there thinking, and I was like, I'm a part of that. That's us. Like, that's what we were doing. Like, we were a part of that. And I think that moment, seeing those statistics, seeing the improvement of people's lives, I think that was a really rewarding moment. And I remember leaving the all hands, and I looked at my team, and I was like, oh, like, we're a part of that. Like, that's so cool. And then, like, I'm like the public health nerd of the team. And so of course I'm nerding out, but it was, yeah, that's one of the most rewarding moments, was seeing the impact.
I was also going to ask if you could expand a little bit on like what your specific role is. It said you were an analyst, but I was wondering what that entailed.
Yeah, so I work, as you've heard, in the Division of Global HIV and Tuberculosis with the program budget and extramural management branch. And so what we do is we kind of manage the money that comes from the President's Emergency Plan for AIDS Relief, PEPFAR. And we work with our over 40-something CDC country offices on, and my team in particular, in the branch, we work on developing notice of funding opportunities with these countries to help identify and identify partners to work with CDC on cooperative agreements to, provide prevention for HIV, treatment, care and treatment, laboratory services, so on and so forth. And so that's what my position is as a public health analyst, is helping these countries develop these notice of funding opportunities and identify partners.
Yeah, I had a question. I wanted to know kind of what your process was like when you were deciding like a master's program, because I feel like whenever I'm like researching, I get like bombarded with like a billion different programs, and I'm like, how do I figure this out?
Yeah, that's a really great question. So I will say, when I applied to undergrad, I knew Converse was my place. Come heck or high water, that's where I was going to go. My mom, my sister, my aunt, and my two cousins had all been there. It was a dream of mine since a little girl. So I only applied to Converse. And then I think around the time I was supposed to hear back, I was like, oh shoot, I need to apply to a backup. So I quickly applied to a backup. Well, fast forward to applying to graduate schools, I was terrified I wasn't going to get into a graduate school. And so one of my professors, he gave me the advice of applying to several schools. And he was like, kind of have a ladder, have like your realistic schools that you're realistically, you think you're going to get into, some like shoe-in schools that like, you can get into, and then like your shoe for the stars schools. He's like, kind of have a range. Don't, apply to all the Ivies. and and not have a range. And so that's what I did. I applied, I applied to Columbia University and Emory University, and then I applied to more smaller programs, all very good programs, mind you. But I did apply to a range. That was the advice for just kind of peace of mind more so than anything else. And you do have to consider like applying to graduate schools can be pricey. I've heard that they're like waiving fees now, and that's really awesome because my Christmas presents senior year of application fees. When my family asked me what I wanted, I said, money to pay for graduate school application fees, please. So that's that was the advice I was given, and it really helped me give a peace of mind. Also look into location. What does that school have to offer you resource-wise, alumni network-wise? So I chose Emory University because it's right next door to the CDC. Like literally you look out your classroom window and there's the CDC infectious disease lab tower looking right at you. And my goal was to be at the CDC. So when it came down to it, deciding between programs, it was kind of a no-brainer at that point. If CDC was where I wanted to be, that's, that was my graduate program. If you want to do hospital administration work and location isn't, like very specific, like Atlanta, Emory, CDC, if you're just kind of wanting to do hospital and where you end up is very fluid, choose a different kind of criteria, something that matters to you, whether it's the price of the school or the location or how close it is to where you live now or how far it is from your family. That was another part, was the location of the school and the resource of alumni.
And I didn't realize Emory was so close to the CDC. That must have been awesome.
So, fun fact, Emory University actually sold CDC a parcel of land for like $10. There was a collection of money, and it was CDC sold the land that the first CDC campus was built on for like $10 or something.
Wow, that's really cool.
It looks like I got a question in the chat. They wanted to ask about the biggest challenge on my journey in public health, and what has been my biggest challenge so far in my career, and how did I overcome them? I would say the biggest challenge for me was actually my lack of professional experience. So I remember I applied to like 25 internships when I got to Emory, and I got an interview for 2. And a lot of my classmates that had previous work experience, they were getting interviews left and right and getting calls, and that was really discouraging. But I think there is a benefit to going straight from undergrad to graduate school. I had amazing study habits already in place. I didn't struggle with the balance of schoolwork, homework, life work, internship. I didn't have to relearn those habits. So that was a benefit to going straight from undergrad to graduate school. But that was a big challenge. It's just a lack of experience, a lack of professional experience. But I overcame that by just, pushing harder. And I actually took the first job offer I was given. I interviewed for 2 positions. I kind of wanted the other one, but the first one offered me a job first, and I said yes immediately. And it wasn't necessarily a job I was like gung-ho, like excited for. It wasn't necessarily in an area that I was passionate about, but I'm so glad that I took that opportunity, because it actually was probably one of the best internships I would say I heard from my classmates. And I'm a little biased, but the opportunities I was given in that position were just far and beyond. Like I wasn't taking meeting notes. I wasn't, just doing intern grunt work. I was, tasked with pretty much helping manage a program. I was given a lot of responsibility. And so I think that's how I overcame it, was, saying yes to every opportunity and really just trying to get that experience. I recognized I didn't have it, and I just said yes to every opportunity I could.
That's really great advice. It's great life advice too. You know, and a lot of different panelists have talked about, you know, they weren't sure about an internship opportunity, or, you know, they didn't want it, but they did it anyway. And, you know, it ended up impacting or helping them in some way. So that's great. That's really great.
That internship was hands down life-changing. I mean, they are the ones I did my practicum experience with. And actually, my practicum experience was analyzing the history of the epidemiology elective program. It's a medical and veterinary student program. Sorry, my dog wants to play fetch. It's a so epidemiology elective program is what I was working on, and my practicum with this internship I was not so sure about. I did my practicum with them. I did the state of the program report, and a year after I left that internship and had done this state of the program report, I got an email from my previous boss, and she said, "Hi, I just wanted to let you know that our branch chief was speaking with CDC, Dr. Robert Redfield, and he was mentioning how we need a program for med and vet students." And our branch chief said, "Actually, we do, and here's the state of the program report." So my report that I did for my practicum was given to CDC Director Dr. Robert Redfield. And that just goes to show you never know what opportunity is going to give, like what taking that opportunity, taking that internship you're not so sure about will give you. And that's a big testament to just taking whatever experience you can get.
Absolutely. Well, Natalie, thank you so much for joining us today. I think we've still enough of your time. Go play fetch.
Right. I know my dog's like, okay, enough time talking.
But I want to thank the students as well for coming on today. You asked great questions, and we'll post this recording. So if any of your colleagues didn't get a chance to see it, we'll post it on our website. But again, thank you, Natalie, and thank you to the students, and we'll see you all soon on other career chats.